Good morning. This is Dr. Dress from Avana Plastic Surgery in Miami, Florida, and today is a brief discussion of what I feel is the best route of your post-operative care course after you've received surgery down here in Miami with regard to either open or liposuction based operations. The most important thing post-operatively is nutrition, and without adequate nutrition there's no chance to heal. Because most of us are a carbohydrate addicted society, we want to really increase your protein intake to at least 30% of your total daily caloric intake, such that that becomes a common and muscle memory type response after surgery. You want to increase your protein intake through natural foods, if at all possible, using certainly any meats or egg whites or dairy products, but also many forget nuts and beans are a very important source of both protein and carbohydrates in our diet. And make it a snack throughout the day. You can pre-fill little baggies with your favorite nuts and even jerky to ensure that you've got those protein building blocks for healing. We don't have a storage form of protein, so if you aren't consuming it, you're not getting it. And it has to be eaten daily and around the clock in order to have the maximum availability for healing. In addition to having your compression garment for whatever part of your body that was operated on, and staying in that garment around the clock for 6 to 12 weeks, depending on what operation you had, you have to have the building blocks to produce the scar to hold your result in place. And if it's a liposuction operation, in order to have the building blocks for the scar tissue all underneath the liposuction areas that ultimately 2 months after surgery contracts and pulls in to create the skin tightening that everybody is looking for in those areas. Additionally, I get asked frequently is, when can I exercise again? And if it's a liposuction based operation, 1 month is my routine answer. We do not want your skin envelope having any shearing over the underlying muscles that could complicate the healing, could hurt those newly formed scar tissues, and also even create delayed fluid collections that might even have to be drained by us here in the office. My recommendation in that regard is hold off on anything but walking until you've reached at least 1 month, and sometimes even 6 weeks after surgery. And when you do restart your exercise regimen, always start low, go slow, premeditate if need be with anti-inflammatories such as ibuprofen and or even muscle relaxants such as Flexeril to prevent prolonged cramping and discomfort after your exercises.